A drug that reduces the risk of heart attack will be sold over the counter in pharmacies from today.
Until now, Zoccor has only been given on prescription to high-risk patients.
But some doctors aren't happy, insisting it should be available to all on the NHS.
It's people like Steve Akid who could benefit from wider availability of cholesterol-lowering drugs. He had no idea he was at risk of a heart attack, but after an emergency operation to unclog his arteries, doctors said he was lucky to be alive.
It just came out of the blue. I mean, I suppose I didn't have an ideal lifestyle, but I didn't think I did anything to excess, really. But I'm sure it could hit anybody at any time.
From today, a cholesterol-lowering drug called Zoccor will be available from pharmacies without a doctor's prescription. More than 7 million people are at risk of a heart attack, but don't know it. And the Department of Health believes easier access to the drug could save hundreds of lives a year.
Whether you're going to suffer or I'm going to suffer, we don't know unless we've got a family history of it, and therefore we're alert to it. But otherwise, there's a high proportion of people out there who don't know but are at risk.
Anyone over 55 or anyone over 45 with a risk factor such as obesity will be able to get treatment from a chemist. A month's supply will be £13. That's twice as much as it costs on prescription.
According to the British Medical Association, this is the first time the public has been asked to pay for a drug that prevents ill health. And it says that if a drug is worth taking, it should be available to all on the NHS and not sold over the counter to those who can afford it.
Other medical bodies have also warned that many patients would do better to alter their lifestyles than pop pills. Thomas Moore, Sky News.